You're listening to the OCD Stories podcast, hosted by me, Stuart Ralph. The OCD Stories is a podcast dedicated to raising awareness and understanding around obsessive-compulsive symptoms. I do this through interviewing inspired therapists, psychologists, and people who have experienced OCD. Welcome to the OCD Stories. And welcome to episode 402 of the podcast. And in this one, I interview Melissa Mose. Melissa is a licensed marriage and family therapist who treats OCD. Melissa is also president of the ISDF affiliate OCD SoCal. We discuss her therapy story and what is internal family systems therapy, or IFS for short. We discuss parts of us, merging IFS with exposure and response prevention therapy, OCD being a cluster of parts, thinking about parts of self during exposures, and much, much more. And thank you to NoCD for supporting the podcast. NoCD offers effective and convenient therapy available in the US and outside the US. To find out more about NoCD, their therapy plans, if they currently take your insurance, or to download their free app, head to go.treatmyocd.com/the OCD stories, or the link will be in the episode description. Thank you to all of our patrons for supporting our work. To sign up to our Patreon and to check out the other benefits you'll receive as a patron, please see the link in the show notes. So thank you to Melissa for her time. I really enjoyed speaking with her and hearing more about this different view and way of looking at ERP or doing ERP. And thank you as always to you guys for listening. I deeply appreciate it. And without further ado, here is Melissa. Welcome to the podcast, Melissa.
Thank you. Glad to be here.
Yeah, it's good to have you on. And before we get into today's topic, it would be good to hear your therapy story, your therapy journey, just so the listeners can understand more about you and what got you into treating OCD.
So, yeah, I've been a therapist for almost 30 years at this point. And for the first 15 years or so, I was a family therapist. I specialized in working with teens and their families. And then one day my daughter woke up, and like a lot of parents, I can tell you the date, with a sudden onset severe OCD. And she was, asking questions over and over for hours. And as somebody who had the usual very minimal training in OCD in graduate school, I at first didn't know what was happening and got confused and scared. Then, because I do have resources, I was able to do my research. And then I found I had a really hard time finding her good help. So it took a long time before she found an intensive outpatient program for pediatric OCD. And what happened was I went through this with her and I watched her get better. And I thought, I want to do that. I want to learn how do these people help help people so dramatically to really heal. And so I think that year flew back to New York, did my first behavioral therapy training institute, found IOCDF, and went to my first IFS or OCD conference, and found people who understood me and got very, very involved from there. So at that point, that's when my practice really shifted. And so it's been about 12 years now of treating primarily OCD, because I worked with teenagers. I see a lot of teens and families, but adults as well. And so that's how I got into treating OCD. And continues to be my passion to work with parents and help people get high quality treatment, because one of the sad parts was that we did find a lot of people who tried to work with her who didn't understand OCD. And I was told she was sad that she didn't have a sibling. I was told that a lot of these stories that those of us who work with OCD have heard. Yeah. And then I discovered IFS. I was a friend of mine had published her first collection, edited her first collection of articles and writing about IFS. And it was very intriguing to me because of my initial my initial therapy work was more in that domain. So it was early days for IFS, and I got into a training really easily, which people can't really do right now. But it was fascinating to me. And so I went through the process, and I found it really useful. I found it very similar to things I already do. And started really thinking through that lens is really more the way I would put it. And at first I found IFS really useful for clients who weren't quite ready to do ERP. And that's sort of how I was using it. But over the years, it's unfolded, and I've learned a lot from doing that work. And that's how I got here.
Nice. Thank you. And with IFS, so as I said off air, I've done a few episodes on it, but assuming a lot of people listening wouldn't have heard those episodes or ever come across internal family systems therapy, how would you set it up or describe it to those people?
Yeah, internal family systems been around for a long time. It's really taken off, so a lot of people are hearing about it now, which is interesting. But internal family systems starts with a concept of multiplicity, right? And basically was born out of the fact that clients use parts language naturally, right? So we've all said, well, part of me wants to go exercise. I'll use one that's relevant. Part of me knows I need to get some exercise. Another part of me has a lot of work to do and wants me to make sure I get that done, right? So people just naturally say that. And so Dick Schwartz, who started IFS, was listening to that and learning from what he heard his clients say. Where it takes it a little further than just ego state psychology or the idea that we have different states of mind at different times or different patterns that run, is that what he discovered is these parts of us kind of interact like a family system. He was a family therapist also. So he found that parts get polarized with one another, right? So the more this one says, don't eat cake, the more this one wants to, yeah. Right? So he started noticing those patterns, or there are parts that team up and like each other and parts that don't. And that, sometimes there's that part that nobody wants to hear from. And that's usually what spurs more extreme behavior. So internal family systems is really the idea that we aren't just a monolithic me, but we all have a self underneath all those parts. And like a lot of other theories, we talk about self with a capital S being something that everybody has. It's that conscious awareness, that presence that people have when their mind isn't filled up with all of these different voices. And IFS is really about noticing what gets in the way and helping it soften back so that we can be more present and awake and self-led in our life, rather than led by, sometimes I do this and sometimes I do that.
So is that self-led as opposed to part-led? Is that fair to say?
Yeah, it is. It is. And it's not that we're ever purely in this transcendent self and all-knowing. And the goal is really to acknowledge that our parts are important. They represent our personality, right? There are traits, there are skills, the way we interact with the world, how people know us, our individuality. They help us get things done in life, right? I do get into work mode and, that I get very focused. I have these parts that I rely on to keep me organized and functioning. So it's not that parts are bad, parts are good. Even parts that are problematic are seen as good in IFS, which is where we start to shift the OCD narrative a little bit. There's this belief that there's a good intention there. So the goal is in IFS really is to create more harmony internally, right? Just like in an external family, you don't want to get rid of the problematic family member, right? You want to help that family member participate in the family dynamic in a more harmonious, balanced way. Want to communicate. So yes, it is to be more self-led. That's what, the goal.
Yeah, I like that. And then with the parts, like you said, there's no. I think isn't it Dick Schwartz's book is No Bad Parts, isn't it?
Yeah.
Okay, yeah. No, I haven't actually read it. I just in the office behind me, the therapist has that book, and I see it all the time.
Right.
It's a good.
Yeah,
good
that's
title.
one of them, and it's a nice one. It's his newest. I think it's his newest book. He's also written Greater Than the Sum of Our Parts, which is for individuals as well. I think that's an audiobook, but yeah, No Bad Parts.
No Bad Parts. Okay, nice. And there you said, one way maybe to look at OCD is it's actually trying to help us. Well, that's I don't think you said those words, so that's how I actually describe it to my clients. I kind of say if you want to see it as a bully, we can see it as a bully, and I can go along with that language. And I did for many years if I'm doing self-disclosure. But I kind of say it's your brain trying to protect you. It thinks you're at risk. It thinks you're in danger, and it's trying to help. It's just not helping. And we need to kind of show it that it's okay. We need to calm it, soothe it, be kind to it effectively. I never say that, but that's what I mean. Is it both the OCD part and just parts generally, when they are problematic, is it fair to say at times they're not bad parts, but they're parts that maybe are hurting and need attention? Is that another way to look at them?
Yeah, that is another way to look at them. And there are parts that are hurting and parts that are trying to help. And I do use the language that, and really help people see, just like what you're saying, that sometimes we conceive of it as the bully in my brain, and we fight OCD, or we talk back to OCD. What IFS brings, and I love that I think a lot of people are shifting that conversation a little from fighting it to something else. It is that it's truly relational, in that, like, what it reminds me of is when I would work with teenagers in the early days, and they would have these conflicts with their parents, and their parents would be, putting limits on them. And what I would say is, if you want your parents to relax, the first thing you need to do is acknowledge that they have a point, right? Right. If you say there's no problem with that party, and it's not a big deal that the parents aren't going to be home, and everybody, if you argue with your parents, they're going to look at you a certain way. But if you say, hey, you know what? You make a good point. There aren't going to be any parents home there, and I can see why you'd be concerned about that. And would you like to hear what I'm going to do about that, or how I'm going to deal with it? And there's a whole different thing that happens. Parents relax, right? And I've been teaching teenagers that for decades. And it's the same thing internally, right? So if you have a part that is, or a voice, or however people experience it, a lot of people have an issue with the parts language, including family members of mine. So I've gotten really good at phrasing it differently. But if you have a part that's saying, oh, you can't do that, and what if this happens, and look out for that, stop it. We know that doesn't work. We know trying to stop the thoughts doesn't work, but to say, okay, I get why that part's doing that. Good point. Could be, and then it softens back, it can relax a little, or the must do's, the imperatives. When you take a different stance, you relate to them differently, they do tend to relax. And then you can do whatever the valued living is, and that piece. But to actually answer your question, because I was, I think, responding to what you had said previously, to answer your question about parts being in pain, and parts really suffering and trying to relieve that pain. I do think that IFS is really great for addressing that a lot of what OCD is this pattern of protector parts that are doing just that. They're trying to protect us from feeling something that could be potentially intolerable and interminable, right? Well, if I wouldn't be able to stand it if, and then those parts jump in.
Yeah, really good way to look at it. And I guess thinking about the teenager example, kind of diffusing the parents, putting their mind at ease. A client comes to mind actually, which I'm going to use that with. But where am I going with this? Is that so? Do you teach people with OCD to kind of do that same sort of technique of, okay, I see why you're anxious or scared about this, and that's okay. This is how I'm going to address it. Is it that? Yeah, that sort of inner dialogue. Do you encourage that?
I do. And I, sometimes, sometimes I'm using just IFS with people because that's what they want. That's what they come for. But when I'm doing IFS, I have an exposure mindset, right? Because if we sort of step back and look at things, and everything we do in IFS is a sort of exposure, really. But what we want is to have enough of a self present when we're doing the exposure that it actually registers. So part of the beginning phases of the work is really to identify the obsessing voice, and in IFS, the protectors tend to fall into the proactive protecting parts, which are like which are called managers. And I think most obsessions are in that what if, look out, don't do kind of proactive protector role. And then the firefighters, which jump in and fix it once things have gone wrong, right? So compulsions, washing, checking, doing the mental review, whatever the compulsions tend to be, come in and are reacting to the uncomfortable feeling. So the first step is really to use what IFS calls the 6 Fs of find the part, like that we're just recognize it, and focus on it and flesh it out a bit. So we do something that kind of maps on to act very well in terms of trying to unblend from the part. ACT would call that diffusion, right? So the first part is to get a sense of differentiation by putting it out there, locating it, externalizing it. And then by kind of getting a sense of how you feel towards the part, we can tell if a person actually has a lot of presence, right? Like there's a lot of talk about self-compassion in the OCD community, and it's spot on, I think, and it's so valuable. Sometimes people have a hard time accessing self-compassion, right? Because they have this other part that's going, that's ridiculous. Why does this keep happening? That critical voice, right? So if you say, how do I feel towards that part? And here, I hate it. Then we sort of look at the part that's hating it and get that one to relax a little bit until we can actually find some real compassion for the part that has the obsessions, for that obsessive voice. Because once we're curious about something, including a voice in our head that's throwing obsessional thinking and doubts into our minds, once we're curious, it doesn't have us quite as much anymore. So that's where that get to know it dialogue comes in, because it really is that unblending it and befriending it that helps a person be more present and do an exposure type activity or be in life or experience the feeling that they don't want to have have that encounter with something difficult without the struggle going on internally.
Yeah, that's really interesting. Yeah. No, I'm just thinking about that in relation to my own work. It makes me think of, so I use compassion focused therapy a lot. And in particular, I do a lot of chair work, but from a compassion focused therapy lens. And there's a lot of parts work in that of getting the client to embody the inner critic or the OCD part or the guilty part, whatever it is, and interview them, and then embody the compassionate part and responding. It makes me really think of that in some way, and how powerful I've seen that be in the room, when people really embody the part and talk.
Well, they originate very close together, IFS and compassion focused work, actually. Yeah, they're very, very similar. And whereas I think what's nice about IFS is that it helps people find kind of a side door into compassion by noticing what's in the way first, right? Like what's getting in the way. And then when we address that, embody it, get to the point where sometimes it's just like, do you get that? Yeah, I get that. Okay, so now that you get that, there's a sense of connection and also differentiation that happens, because there's an I who gets where that's coming from. And so inherent in that is a little bit of that connection and compassion at the same time. Yeah.
Really good point. Yeah, I mean, people can really struggle with compassion, not just people with OCD, but anyone. And it can be a real barrier sometimes to get over that.
And what I love about IFS is whatever's coming up with the specific person, we can say, well, let's explore that, right? There's our encounter. That's the part that we can relate to for a minute. Right. And so then that's our way in to wherever the work happens to be with that specific person in a very experienced near kind of way.
Yeah. And let's say that part, the resistance that comes up and we identify it as a part. Do you name it one of the IFS names like manager, protector, firefighter, or do you get them to name it themselves?
Ideally, they name it, and that can be, in any number of ways. I have people that talk about their frantic part or their, disgusted part. Some people, I try not to do a lot of explaining, teaching, unless people want it. Right. And I think that one of the things that IFS really brings is the idea that as therapists, it's important for us to be as self-led as we are able to be with something. So if we have an agenda, that's a part of us that has an agenda. And, in a way, when we can be curious, and I think probably most therapists that I know will acknowledge that at the moment when you don't know what to do, if you can get out of that thinking part of trying to figure it out and just be curious and present, it unfolds, right? And so for us as therapists to be able to be curious is an important piece of it. Yeah.
Really interesting, actually, because there's a 3-page psychodynamic paper that was recommended to me when I was training by Wilfred Bion.
Yeah.
And in it, he talks about when you go into the room, you need to be a blank slate, not blank slate in terms of Freudian, where they can project onto you, but go in with no agenda, go in completely unknowing what the session's going to bring, which doesn't entirely work from an ERP point of view because you need some kind of plan. But I do it relates to what you're saying. And he also said there should be 2 anxious people in that room.
Yeah.
the therapist should be anxious too, like, where's this going to go? How's it going to unfold? And yeah.
Well, I think that to say we're completely without an agenda, I think you're right. It doesn't work from an exposure mindset, even really. And I think even Dick Schwartz and IFS would say at this point that there is a stance or an intention when we're self-led, and that is to provide an experience that's healing and we, to not block, to not move away. There is a move towards kind of a stance, which is unblend and befriend, essentially, and to help really develop internal trust in that self-led state, which is what I find really beautiful, in that we can do both of these at the same time. We can do exposure, even ERP, which is just one way to do exposure, and be operating in a truly IFS consistent manner, because exposure is just really encountering something in a state of openness, right? And with the opportunity to have a new experience, and that's what we're doing internally with IFS all the time. And so you can use even ERP in a way where it's just an opportunity for parts to learn or have an experience that self is able to handle that difficult feeling. It develops trust. The more you do things that are challenging and are fine, the frantic part notices, right? If you want to personify it in that way, which I understand is problematic for a lot of people, but that frantic part notices you can handle it and softens and doesn't take over, doesn't hijack as much.
And is that frantic part noticing that you can handle it, or that other parts can handle it?
That's a really good question. I think it's both. I think it's because if you really look at the family systems, the dynamics of what's going on, parts do respond to one another. So I think that it's what we're really going for is that self to part trusting relationship, right? So trusting that a person's capital S self is present and is actually the one who's leading and managing, is really the CEO, if you will. But it's also a matter of trusting that other parts will be in relationship to self as well. So the other category of parts that we haven't talked about are what IFS calls exiles. And those are the parts of us that carry all the difficult feelings that we walk around in the world with our protective parts trying to not have. Like what I don't want to feel, right? I don't want to feel bad. I don't want to feel shameful. I don't want to feel threatened and vulnerable. I don't want to, in some families, people don't want to feel angry. They don't, that one's something that gets exiled, and they develop very people-pleasing skills in order to not get angry, or accommodating skills. So anxiety is one of those things in OCD that comes up, but it's not always anxiety, right? It might be disgust, shame and guilt, a lot of guilt with harm OCD. I don't want to feel responsible for something bad happening, right? So that would be this third part that carries this, like, it's my fault kind of feeling. And so in a way, we want to be able to encourage those, we want to bring those parts out of exile, essentially, and have them be a part of the family again, a part of our experience, a part of us that we can have. And so, protector parts do learn to trust that exiled part isn't going to hijack and overwhelm the system, because that happens a lot because they've been pushed away, right? Like anybody that gets pushed away, they come back with a vengeance, right? And they get really loud. And it's like, if you're not going to listen to me, I'll get louder. And that's what we see in OCD, right? The more we try and eliminate it by just like pushing it away or fixing it with a compulsion, it doesn't get heard. It still can't be had. And so in a way, what happens is these protective parts, although they're intending to be helpful, intending to keep the peace and equilibrium, they're actually hurting and sometimes scaring other parts of the person. Exiles, like don't get to be experienced, right? And compulsions make sure that happens. But then a person doesn't get to know, well, I can have that feeling and still be fine. So there is an internal trust among parts. Like, I think if I'm really in the language of IFS, I would say you want your protector parts watching while you encounter that exile, right? I played with the idea of ERP as encounter and relate to parts. Because really that's what we're doing. We're encountering an exiled part of ourselves and we're relating to it differently. We're welcoming it, right? And we're also relating to the protector parts with, it's okay, I'm here, I've got this. You can relax. You have a good point, but I've got this. It's not relevant right now. I'm here. So it's a lovely metaphor. And people experience it as deeper than a metaphor and very validating when these parts of themselves get heard.
Absolutely. And where you were saying about when the exiled part doesn't get heard, it kind of keeps knocking and knocks louder, and then that maybe is the OCD getting bigger. I think I may have said this in one of the past IFS episodes, but it always reminds me of Sigmund Freud's quote of, what was it? Something like, repressed emotions never die. They get buried alive and come back in uglier ways.
Right.
And always exiled parts always makes me think of that. And then the OCD is the uglier ways that it's coming back.
Right. I think, but I think of OCD as many parts, which is another way that I think it's really useful and can be, you can take, just these concepts of my OCD tells me, but I know better, which is kind of blunt, and get really nuanced about it. So, just like I feel like IFS really maps on to everything we do already, right? It maps on to exposure and even to ERP. It maps on to ACT in many ways, maps on to ICBT in ways, because there's this feared possible self that we're experiencing. But when that exile part or that feeling takes over, we have to have a way of being present with it. And that's something that we develop over time. So, yeah, I think I lost my thread there of what your question was. Trying to bring.
Was just talking about Sigmund Freud's quote of
that it takes over with a vengeance, and it can. Oh, and I was saying that OCD is a cluster of parts, because that a lot of times we have the obsession, right? There's the part that's obsessing, and we're able to not do a compulsion, right? And we might feel differently about. So some people will identify their OCD as more of the obsession. Some people will identify their OCD as more the rituals, and some people identify their OCD as the intolerable experience of anxiety or disgust or whatever. So it's all of these, and we can really kind of home in on what's relevant to the person in the moment, in a deeper way. And I think actually it's a way of doing exposure that's sometimes I've had people say, I've done ERP before. I've never really experienced it this intensely before. It's a much more connected kind of contact with an experience when you sort of separate it and understand the nuances of the different aspects of OCD.
Yeah, that's interesting. And I want to ask you about that in a second. But a question that comes to my mind is, it was your daughter, wasn't it? Yeah. And obviously she got unwell quite quickly with OCD, and then you managed to get her intensive outpatient, and I'm guessing that was mainly ERP. And obviously it sounds like she got better. So what was the incentive for you to introduce IFS alongside ERP when you'd already seen ERP be quite effective?
That's a great question. She also never wanted to go to therapy again.
Okay.
It was very painful and very challenging. So there was that. And a lot of people, that wasn't the sole reason. I mean, I'm a curious person. I'm an integrative person to begin with. And it felt like it mapped onto me. I could hear the parts language. I'd learned IFS because I'm curious, and I'm always searching for things that have another angle. I love it when there are two things that appear to be diametrically opposed, like ERP and IFS, and the people in the IFS community might not be real keen on the idea of doing behavioral work. And the people in the OCD community might think that sounds really weird, talking about to your parts, right? Mm. And what I recognized from my early experiences in college, where I discovered Buddhism and met a meditation teacher that I worked with for decades, is that at the core of both of them, underneath them both, is this idea that what we want to do is open to whatever is arising. We want to experience it, but not necessarily believe what it's telling us, right? We want to be able to have the experience, open to it, and still be present with it, right? But what I didn't really decide to bring IFS into OCD. I noticed that we're doing a lot of the same things. And I noticed I could do them more effectively when I brought that mindset. When I looked at exposure work through the IFS lens, it came alive, right? So instead of just, we do these exposures and we do this ritual prevention and it's this technique, it became more of an art, and it more relational, more attuned, and I found I was getting better results, is really the truth of the matter. Yeah. So I can say I did it because some people need a kinder, gentler way, and that's true, right? Mm-hmm. Some people just won't do ERP. They won't do exposure work. Some people have trauma in their past, and they feel like being told to sit with an experience that's really uncomfortable is just not something they're willing to do. And what I found is if you're open to another kind of language that just speaks to people in a different way, you really can do the same kinds of things. You can actually access the same things that we know work and do it in a way that will actually help more people. So that's how I ended up bringing it into my work. And like I said, I think originally it was working with people who just were not wanting to do exposures, were afraid to do the exposures. All right, well, let's work the part of you that's afraid. Okay, we get that out of sort of to step to the side. It's a little easier. There's also the piece that because of my 15 years as a generalist clinician working with all kinds of things is I know that people rarely come in with just OCD as a problem. Yeah. Right. So for me, my work is not just about symptom reduction at this point. There's a lot of different things that come around. There's the family dynamic, which was another thing I originally thought IFS would be very helpful for. I've done the space training and absolutely love space. As a parent, right? I knew that I could know exactly what to do and couldn't do it, right? So to be able to work with the part of me that was like very scared of what might happen was useful. So there was that as well. But I just think that there are just so many different ways that it's useful, and I just started noticing that. And I don't think you have to give up one for the other. I just really don't.
Yeah. Good.
Yeah.
I agree. I'm integrative as well. Things are better together usually. Yeah. So let's say I'm a new client of yours. I've got OCD, and I know you do IFS and ERP. I want ERP because that's the gold standard, I've been told. But I've tried ERP other places. It hasn't quite helped me. That's why I've come to you. How am I going to experience ERP with you compared to the past two therapists I've done it with, where it's been more traditional behaviorally?
Yeah, that's a really interesting, good question. Yeah. I think that if we're starting with the idea that we're going to do ERP, what would happen is, because some people will come for ERP, some people I don't actually do IFS out loud about at all. Some people I do IFS and I'm not doing ERP or exposure. Because I really think of it more conceptually as exposure work out loud. I don't use that language, but I'm kind of have those two lenses. So you might come in and you would start talking about what's going on for you. And you might be saying something along the lines of, you have a thing coming up. You're supposed to go to lunch with family member, and you have all of these thoughts around where they've been, what the contact that they've been making with other things. What I would be doing is listening to what you say, and I would reflect it back in parts language. So sounds like, in a way, you've got a part of you really wants to go do this, and then there's this other part that seems to be shouting these warnings, right? I have thoughts of, what if this, what if that, you have to do it this way, that kind of thing. And then I might say, well, I might sort of explore that. I might do more focusing than a traditional or conventional exposure therapist on how do you experience that voice, right? How does that show up? How do you feel it in your body? Does it have a certain sound, right? Do you recognize that voice? Yeah, it doesn't sound like me. Oh, okay. So we might get to know that a little bit. And then I might say, how do you feel towards that part? Well, I'm really intimidated by it. I think, I feel like I feel compliant. I feel like I know that I need to do some of those things. Otherwise, blah, blah, blah. Okay. So there's another part of you that's intimidated and compliant. And then we might sort of focus on how that part really has a point, because wow, when you get flooded by the energy of this fear and agitation, it's really overwhelming. And then rituals start, right? So we might work with that for a little bit until a person can be aware. Sometimes we use like a externalizing technique, like putting the parts around a conference table, right? Mm-hmm. Okay, so you're aware of this and you're aware of this. So they're not you. They're not the whole of who you are, right? And get to a point of being curious about what would happen if I decided to go there, touch this, do that, recognizing these voices and sort of letting them know I'm present and doing it anyway. So exposure might happen just exactly on the surface if you were watching me. Let's say it wasn't lunch later. Let's say it's like I don't want to, pick up that book. We might go ahead and pick up the book just like any other person. We might not, actually. If I were doing more traditional ERP, we might be working with what is more an imaginal kind of exposure, completely internally. If I were doing more IFS. I don't remember what I said. I get all, there's so many letters. But if I'm doing an exposure approach, I'm doing it with constant awareness of who else is talking in your head right now. And so you can have one foot in and one foot out. Can you recognize that? What's that like? Okay, maybe you can take a step back and get a little separation from that voice, that will allow you to actually try. And then when they try, we're being with the feeling. And when other things, this is the other thing that makes it really effective exposure work, is a lot of times we'll be doing exposures and people are meanwhile having neutralizing thoughts going on during the exposure that we don't know about, right? Mm-hmm. So if we're identifying those parts during the work, we can recognize it and help that get out of the way so that we can get even closer to the experience.
Mm. It's taking people deeper almost in a kind of way within the exposure.
Yeah, it slows it down.
Mm.
And by slowing it down and by getting that holding on too tight, kind of powering through it mentality to soften, people can experience whatever that feeling is and be closer to it, but also have the recognition that I can have this feeling and still be okay.
Yeah, I like that. And I guess you didn't use the word interviewing, I don't think, but like interviewing them about their parts while the exposure's happening gives a level of diffusion again, right? Mm-hmm. That yes, I am experiencing all of this anxiety or disgust, but also this other part of me that's kind of okay right now.
Mm-hmm. Yeah, IFS does a lot of interviewing parts. We'll get to know a part in the beginning, especially with protectors, and you'll hear a lot of questions like, "How long have you been around? And what is your job? What do you do for me?" And I find it's a really valuable assessment tool, because when you have a protective part that starts to tell you what their job is, and you ask, "Well, what are you afraid would happen if you didn't do your job?" Then you get at the experience that we're trying to exile, the feeling we don't want to have. And you can get at it in a lot more detail. And you can help a person access experience that somatically, it may have a source, it may have a whole energy around it. But yes, so the interviewing of the protectors is part of the befriending piece, where it's like, okay, I'm not going to try and get rid of you. I get why you're there, but let me actually see if we can do that a different way. Let's have a new experience with that. Yeah. So
I like that. You're relating to yourself in a much kinder, calmer way,
right?
And
right,
and democratic way almost. Yeah.
And I we're talking a lot about exposure because I think that they really they come together. But there are people who now will call me and ask just to do IFS. And at first, I had a lot of concerns about that, right? If like, can we do this and have it be effective? Because I do think there are things, if we're doing just IFS with clients, that we need to be aware of with OCD. For instance, there's a tenacity to these parts that, if we're being, that's why I really want to help people understand what OCD does, because parts will want to compulsively unburden and exile, right? And so there's this sense of, if we help that exiled part get rid of or transform or release the negative beliefs about it itself, right? Because there's that sense of a part is carrying this really negative belief, like if bad things happen, it's my fault, right? And if we help that part release that belief, that the protectors will not have a job to do anymore, right? And I find that isn't necessarily the case, but that we can really, that even when I'm just doing pure IFS with somebody and they don't want to go do ERP and they won't do any kinds of exposures, life provides the opportunity, and we take a more ACT approach in that way. And doing these internal encounters with parts really is exposure. We're helping people, like you're saying, relate differently to parts of themselves that they previously either didn't want to have, or parts that they believed were them, that had taken over and completely eclipsed the idea that, oh, I actually know, you can get there usually with most people. I know that I don't need to be doing this. But that gets really blocked by very tenacious, very well-meaning voices, parts, compulsive urges, etc.
Really, yeah, that's really interesting. So, is there anything else you wanted to say on IFS before we kind of change direction?
Well, I think that IFS in particular, I think it's very powerful modality. I think that, there's some question about it being empirically based for OCD. And I feel like it really maps on to empirically derived modalities that we're already using. And if we think of it as an approach and a lens and embrace it that way, it just can really deepen the exposure work that we're doing and really help a lot of people. And I think, as I said earlier, it's great with so many other things that people carry and struggles that they have, whether it's depression or addiction or whatever else people are carrying, and the external family system as well, which is something we haven't mentioned, because family accommodation, of course, is a huge piece, and it's a beautiful way to work with the family accommodation issues. That's another whole conversation, but I find that when you're really looking at the internal and external system, then you've got a lot of options as a clinician.
Yeah, really good point. Okay, so pick up the phone and call the 20-year-old Melissa. What do you tell her?
Oh, wow. Yeah, that's always a good one. Trust yourself. 20-year-old Melissa was an English major. I didn't even take Psych 101 in college. I was not interested in being a therapist. And it's amazing to me how I've come full circle to some of the awarenesses that I was discovering at that point in life. And I thought when I started therapy, because I was into in college, I did Jungian psychoanalytic interpretations of literature, and I was into poetry and mythology and archetypes and nature, and then I got interested through a lecture that I went to on psychotherapy and Buddhism with Ken MacLeod, who I thought was just an incredible teacher. And who also, like me, I also have a math brain. So I, at a certain point in life, taught math and English. So I've always liked the opposites. And even back then, I was interested in bringing opposites together. But I thought that therapy was going to be like living poetry. And I was so wrong. And yet, there's an element that there's an art to it, and that's important too. And so, yeah, trust yourself would be listen to all of different voices and stay centered.
Yeah, I like that. I'll ask you more about your Jungian training now, but save that for another time. So you've got a billboard. What do you want written on that billboard?
Right. I forgot about these questions. I didn't prepare for those. Okay, so I'll go with my first response. The first thing that popped into my head, and I don't know what this, there's a part of me that's saying, oh gosh, be careful here. The first thing that popped into my head was thank you. And I don't know why, but I really feel like in the world, like I'm thinking that a lot. I think I look at the trees and I just like, thank you. Sense of appreciation.
Yeah, gratitude. Yeah, appreciation. Nice. Well, yeah, it's so important, right? It just feels great when we are able to appreciate it. It's always a nice feeling.
Right.
Yeah. So, right. Yeah, and then I guess, thank you so much for coming on and talking about this topic and the integration. Like, it's like I'm not trained in IFS. It's not something I do, but I am really interested in it, and I do a lot of parts work myself. So it's great to share IFS and the integration with ERP. So thank you.
Well, thanks for having me. I appreciate it.
Thank you for listening to this week's podcast. And thank you to our Patreons who helped make this episode possible. And if you would like to find out more about Patreon and the rewards and benefits, then there will be a link in the episode description. If you enjoy the OCD Stories podcast and would like to support us with a one-time tip/donation, please go to theocdstories.com/support. All tips, no matter how large or small, are greatly appreciated. Please subscribe and rate the show wherever you listen to the podcast. And thank you to NoCD for supporting our work. And if you want to find out more about NoCD, head to go.treatmyocd.com/theOCD stories or click the link in the episode description. And quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care.